So welcome, good morning, good afternoon, and perhaps good evening, depending on which time zone you're in. I'm Selena Lowe, the Executive Director of the Australian Global Health Alliance. Thank you for putting your time in trust to us today for our special World Health Day event. This event is made possible by a special collaboration with the Australian Climate and Health Alliance, the Australian Network of WHO Collaborating Centres, and our partners, the Monash Sustainable Development Institute and Melbourne Climate Futures, University of Melbourne. But first, I'm honoured and delighted to invite Professor Anne Poelina of Notre Dame University to begin our time together with acknowledgement of country. Professor Poelina is also Adjunct Professor, College of Indigenous Education Futures, Arts and Society, Charles Darwin University. She's a visiting fellow with the Institute for Postcolonial Studies, Melbourne, and the Crawford School of Public Policy at the Australian National University. Professor Poelina is a Nyiyakinawara woman from the Kimberley region of Western Australia, an active community leader, human and earth rights advocate, filmmaker, and a respected academic researcher, with a second Doctor of Philosophy, First Law, titled Matawara First Law Multi-Species Justice Declaration of Interdependence, Wellbeing of Land, Living Waters, and Indigenous Australian People. Over to you, Anne.
Mabubara, ngajunu nilawalan Poelina, ngayo imad waramanen, ngayo mandajara on Jugan and Yaru country in Broome. Mabulian Boro, Mabungaringan Nganga Mujes, Planet Earth on World Health Day. Mabunguringan Nganga misogyny to Mother Earth. Mabunguringan Nganga, the cries of Indigenous people to create peace with Mother Earth and with nature. So in my language, I said, good day. It is a good day to speak and share, and we come with a good spirit in our heart because we see the misogyny across the world to Mother Earth. Indigenous people across the planet are crying out to fellow citizens to say it is time to create peace with Indigenous people and with nature. And I believe that this is a great day to come together and seriously think about the solutions for planetary health and well-being. Because as human beings, we must govern not only for fellow people, but for multi-species justice, for the rivers, for the mountains, for the trees. And all of these are crying out to the humans to say that it is time for a total reset. And we must learn to once again come together in a time of great complexity to see how we can bring our collective wisdom into right-sizing the planet, so Mother Earth will not be lonely without the vibrations of human beings. So thank you very much for the opportunity to open this up and receive what we're saying, the voice of Mother Earth and Indigenous people to come collectively today to start to look at how do we create a unity pathway to heal the land, to heal people, and to heal climate. Kaliyamabu, thank you.
Thank you very much, Anne, for that beautiful acknowledgement. I'd like now to introduce my co-host for this session, Georgia Langmaid. Georgia is currently the Planetary Health Project Officer at Enliven Victoria, which is a not-for-profit and primary healthcare partnership based in Melbourne's southeast Dandenong. She's involved in a number of community-based climate health-related projects. She's also a children's book author, which she didn't put on her bio, but I'm going to call her out on it. And it's a book I really want to read called Joey and the Heatwave. She holds a Bachelor of Health Science honours majoring in health promotion and sustainability from Deakin University. She's passionate about sustainability and planetary health using a health promotion lens. Georgia, you're there. Thank you so much for joining me today and offering your perspective to our conversation. So first, some housekeeping and the agenda. We will have a moderated panel discussion followed by Q&A with you, the audience. Please start to put your questions anytime into our question and answer box. And thank you very much to those who submitted your questions in advance. In the background, our Alliance resident artist for the year, Jessamy Gee, will assist all of us in graphically representing and understanding our conversation. So there's possibly no World Health Day theme more critical for the world we live in right now than this. Our planet, our health, 2022. As Australians, we face, as we speak, in several states, the impact on our health and futures of the direct impacts of climate change in the way of natural disasters, both in terms of destruction of livelihoods and physical and mental health burden. We will hear about some of our lived experiences today, and the management of these challenges. But we are more than a continent island. We also inhabit a region the most vulnerable to climate change. And through this incredible panel that we have joined up today, we hope not only to give a snapshot of multiple perspectives of the theme, but to also leave you by practically drawing some summaries from each intervention of what next, what to do, and with whom. So to begin our session on World Health Day, I have the great honour to introduce Dr. Akim Ali to our screen. Dr. Ali is team leader, WHO Suva, and he will give a key address on the issues facing the Pacific and a WHO message on World Health Day. Dr. Ali spent the last 25 years working as a public health doctor, manager in various leadership roles in civil service, public sector, and international organisations. Following initial clinical posts in teaching hospitals and civil service as a district medical officer of health and director of health services in Ghana, he worked in international humanitarian emergency response with Merlin, a lead UK medical emergency agency. He led global emergency responses and worked as strategist and director in Afghanistan, Congo, Ethiopia, Ghana, India, Kenya, Malawi, Nigeria, Sierra Leone, Somalia, Zimbabwe, Eastern European countries, and the UK. He's also been an executive director of public health for 10 years in the NHS in the UK. Over the last 3 years, he's been working in small island developing states to strengthen health systems, first on the remote island of St. Helena in the South Atlantic as director of the health service, and now in the Pacific, leading WHO Health Systems Unit. And among many other skills, he is a member also of the NICE Guideline Development Group for Pre-Diabetes in At-Risk Populations and has served as an executive council member for the UK Association of Directors of Public Health. Akim, we're so delighted to have you with us today, and over to you for your address.
Thank you very much, Selina, and for that very kind introduction. And good day, everyone. Thank you so much for asking me to join this illustrious panel on World Health Day. As Selina highlighted, the theme for World Health Day this year is probably one of the most significant in recent times. We're talking about our planet, and we're talking about the health of the population living on that planet, as well as the health of the planet. In no time in our history is this more important, based on everything we know about the impact of climate change on our health and the world that we live in. I'm joining you today from WHO office in Suva, a place where we know in very real terms the impact of climate change on people's health, well-being, and the economy. And it's really quite clear that today, as we celebrate World Health Day, thinking about how we maintain adequate, sustainable, and equitable access to clean air, clean food, and clean water is by no means a small feat that we all have to contribute to. And more importantly, we have to live in cities where actually we can protect the planet and we can protect the health of the people who live in those cities and towns and villages. Our whole economy, the health and well-being of the population are so intricately linked to what we do with and to our planet. And so I join you today to celebrate the World Health Day for this year and to keep this theme right at the forefront of our minds. Anybody working in public health would already know that environment and health are so intertwined, so interlinked that they're almost inseparable, because the key determinants of health are actually really aligned with what we do with and in our environment that we live in. Now, in the Pacific, and as in many small island developing states, the real effect of climate change has been felt from the rise in temperature, the rise in sea level, that has contributed a lot to what we see with the epidemiology of climate-sensitive diseases. Here in the Pacific, we know particular times of the year where we expect to see leptospirosis, typhoid, and dengue fever in high numbers. We know when we see diarrhea disease amongst children, and we know how those contribute to high levels of morbidity and mortality in these populations. But those effects are not left at seasons. They actually accumulate over the years. And we need to do as much as we can to stem the impact on morbidity and mortality. But it's not just, illness. It's also what extreme weather events and natural events does to populations here in the Pacific. We know of displacement of population, the psychosocial stress that go with it, the economic stress that go with it, and with a very fragile health system, it's not very difficult to see why repeated climate events and environmental hazards create a major challenge for health systems here in the Pacific. And that is not to say that people in the Pacific, rest and do not do something about this. Nonetheless, the efforts that we make have not, in many ways, been at the level at which we can really mitigate all the impact of changing environment and changing climate on our health in this sub-region. I wanted to really mention one of the few things that struck me when I first came to the Pacific. Just over a decade or so ago, the ministers of health across the Pacific set out in Yanutha in Fiji here with a healthy island vision, which really focused on creating a healthy setting across the Pacific and taking in turn to look at what people do with their lives and livelihood, and also particularly the impact of what people do on the climate and how that in turn impacts on health. They examined the vulnerability of the Pacific to effects of climate change and environmental factors. They picked on issues around air pollution, particularly indoor pollution with cooking with fossil fuel. They picked up on issue of sustainable food supply and the impact it has on nutrition, both in terms of undernutrition as well as perhaps what we all know across the Pacific as a scourge with NCD, non-communicable diseases like diabetes and the overweight issues that come with it. And they've set out over the years to tackle this in very strong position with leadership working from the front on this. But also they bemoan the issues around healthcare facilities that are exposed to extreme weather events, where for many days, weeks, or months in the year, actually they become inaccessible because of extreme natural events. Now, Pacific ministers would also quickly highlight every time the inequitable issues around climate and health, both in terms of access to resources to adapt and mitigate the effects of climate change, and their very limited access to global resources when actually the need has been identified. So it is really a very welcome thing that WHO, working across the globe, and particularly in the Western Pacific region and in the Pacific where I am, is focused really on how we can maintain the health of the planet and the health of the people who live on the planet, particularly in this sub-region of ours. I wanted to commend the work that Fiji government did as president of the parties to the UN framework for Convention for Climate Change, where health became a big topical issue in the themes to be debated. And recently, Fiji has continued work on assessing all its health facilities to look at their vulnerability to climate change and impact of environmental events. Tonga, Solomons, Papua New Guinea, Kiribati, and many of the other small island countries in the Pacific have been doing the same as well. And what that shows, which potentially are the three key messages I wanted to pass on today, is that we can't wait until we have all the evidence about what works before we can start acting. We can do small things now, and we can do them early and maintain the ability to adapt to climate change and its impact, but also fundamentally to mitigate its impact on our people. And some of the things we can do now without waiting is to keep tab on all the traditional efforts that we create in the health service that actually have an impact on climate change, positively and otherwise. And the work we do with the other sectors, be it about transport, be it about energy consumption, that we can take account of those in each of the healthcare facilities that we have, and the way we work with our communities, so that we can account for our action and impact on climate. We cannot, within the health sector, remain hypocritical by pointing out the impact of climate change on the health of people without doing our own bit. We can change the amount of energy we use in our health service facilities. We can look at the way in which we expend water. We can look at the way in which we manage waste, particularly if you look at our current response to COVID-19 and the use of masks and other non-biodegradable materials that actually we do need to take account of in the way we incinerate, or actually in the way we use landfill. There are new technologies that we can use within the health system to manage waste. The second message that I wanted to give today is how we work beyond health. And oftentimes when we have the debate about health and climate, we can easily hide behind the fact that we do not have accurate evidence about all the causality path between exposure and effect. Nonetheless, we know if people use less fossil fuel in transport, people walk, people cycle, actually it has both an impact on the environment as well as an impact on non-communicable diseases that we know is a major threat in this sub-region. So the health service must do its bit to work with other sectors to do something around this. And lastly, I think part of the theme today is to think about what we do now that has an impact on the future. And we must start with our youths. And from my perspective within the health service, working with people who are going to become key health professionals of the future is a very important step for us to consider. When we train people, how do they understand the impact of the environment on health and the impact of health service actions on the environment? How do we take account of what we do differently to positively impact on our climate and our planet? And doing this as part of the basic curriculum, as well as continuing professional curriculum, I think will be an important and very significant action that we can take within the health sector. If we're going to get unstuck, we need to start today, and we mustn't get tired. And by creating that momentum with our young professionals as they join the sector, we can make a big and dramatic difference. So let me leave you with 3 key messages again. Let's start now. Don't let us wait. Let's work beyond the health sector, and let's start very early with our young professionals, so that then we have big advocates within the health sector who can account for our actions and can collaborate beyond the health sector in a strategic manner. So I wish you very good deliberations for the rest of today, and I will stay as long as I can with you at the event. Thank you very much. A pleasure. Thanks.
Thank you so much, Dr. Ali, for quite an inspiring start to our panel and the sobering situation we're facing in our region. Our own country has also recently faced utter devastation by recent floods in New South Wales and Queensland, and we would like to invite Dr. Kim Liu to our screen now. In addition to working with patients in communities in Western Sydney, Kim advocates for a sustainable future through her work on the Council of the Australian Medical Association, New South Wales, and as chair of Doctors for the Environment New South Wales, as well as her many other involvements. Kim is directing her efforts towards a cohesive, positive narrative which inspires people to reimagine what the future could be, one in which all sections of society can step ahead into the next phase with hope. To achieve this vision, Kim believes we need credible emission emissions targets and policy that actively supports the transition to a sustainable, clean energy economy and society. Welcome, Kim. So I've got a question. What challenges do you and your patients experience as a result of climate change? And how do you contribute to change in your area? Over to you.
Thank you. I am zooming from the land of the Darug Nation, whose sovereignty has never been ceded. Now, I graduated over 30 years ago, and just to explain, when we go through medical school, we learn about the biology of disease, and very soon I realised that the environmental determinants and the social determinants of health are equally as important. And we know that Australia is the most climate vulnerable first world country. I work in Western Sydney, where 2.5 million people live. It's highly urbanly dense, and there are more people living in precarity. So we know that more people have died from heat waves than all other natural disasters in Australia combined. And we've experienced this where I've worked. Just in terms of impacts now, we have pounding rain today, where my patients have been flooded for 2 years in a row and had to evacuate 2 years in a row. And this is due to floods, houses being built on floodplains, and this is still continuing. In 2018, 19 and 20, we had heat waves, and within where my patients live, Penrith, we had a day where it was 48.9 degrees, the hottest day on Earth, and it was halfway to boiling point. At the same time, we had the 80 days of smoke from the Black Summer bushfires. So my patients, I had patients who had their babies during that time of the smoke and heat. And because most houses within Western Sydney and in Australia aren't built to be thermally efficient and aren't built to exclude smoke from entering the household, I had so many patients who actually had smoke inside their house, it was hot inside their house, and when they went outside, it was the same, there was no shelter. And so my vulnerable patients, so we know that during any natural disaster, heat wave, or whatever natural disaster, that people over 65 have a higher rate of being sick and dying. So my patients who are chronically unwell, and Western Sydney has a higher load of people living in greater precarity, where there's intergenerational unemployment, intergenerational poverty. And many of these people are the people with chronic diseases. So with the burden of increasing number of people who survive their heart attacks, have heart disease and renal disease, and the greater burden of type 2 diabetes, and also being overweight, people who have all these problems are more vulnerable during heat waves. And with the heat waves, when it's not just people who are traditionally seen as vulnerable, children who have anxiety or depression, or who are on medications for those things, are also more likely to be vulnerable because there are medications that might alter their ability to sweat or thermoregulate. And my patients who work outside, who have no option but to work outside. So, and then we have mothers and babies. And we know that with the building code within New South Wales and therefore within Western Sydney, we're building areas that are urban heat islands. So when I go on house calls, I can see a sea of black roofs with black roads. So we are building so that we're building ovens for our population. And we know that there are safe ways to build our society and the infrastructure that protects the population. And it is just heartbreaking for me when I go on house calls, see my patients, and we haven't had really a relief from climate change and the devastation of bushfire smoke and heat and then with the COVID crisis at the same time. So my population of patients have been pummeled by one crisis and after the other without really having a breath in between. And it's been devastating for the mental health of my patients and my family, and actually myself, because I'm dealing with, so the mental health strain of dealing with these crises. And this is why I kind of stepped into the area of advocacy 6 years ago. And because once you understand climate change and how complex it is, and how our politics and the people who work with policy don't actually articulate how complex climate change is, and that the solutions are complicated, and we need to look at this from all sectors. And it is disempowering when you can see the devastation and understand that what we're living through now is from emissions 20 years ago. And unless we actually have policies and advocacy within this short frame of time, the people who are living beyond this next 20 years, in 2040, are going to be living through, have areas where they cannot live, which is pretty much, I'm worried about the whole of Western Sydney. Unless we do have measures to not just mitigate, but adapt for climate change, we're going to have large areas of Australia that just aren't not going, people cannot adapt to 50 degrees. People cannot live in floodplains, and we need forward planning. So in terms of what I've done for myself, in terms of trying to mitigate and adapt, at home, I've divested from, because divestment from your bank and super, from companies that invest in fossil fuels is really, really important, because it requires money to support fossil fuels, and money going towards a cleaner future. We have a plant-based diet. I've electrified my home. I've planted a food forest in my backyard and a native forest in my front yard. And I've been talking to the media and talking one-on-one conversations with everyone about this. I've joined groups, including Doctors for the Environment, the AMA, Australian Parents for Climate Action, and my local group, the Hills Doctors Association, and the Hills for Climate Action. And I look upon advocacy in 4 big areas. It's really our own health sector. So our peers who work in primary care and in public health need to see that, yes, 7% of emissions are from the health sector, and 4% of emissions are from primary care, but I still advocate within my primary health sector. I see that we need to advocate in civil society. So it really means I talk to Rotary clubs, any public club that doesn't necessarily understand the climate space, and speaking to corporations regarding divestment. So I work within Doctors for Environment. We actually talk to banks and superannuation companies working with market forces and the Australian Centre for Corporate Responsibility. And I see that really advocating towards policymakers and politicians are really important, because if we as the public and as the health sector don't advocate towards the people who actually make the policies, they don't see what our community cares about. So I've been active working with my groups, with our local councils, and the local councils as a group with Western Sydney Regional Councils have actually looked at a plan for heat adaptation. And as a group with Doctors for Environment, we've actually been lobbying through state parliament regarding coal licensing, for ministry to have a climate and health group within the Ministry of Health, and at a federal level for actually having a sustainable climate and sustainability group within the Ministry of Health. So we kind of, at this point in time, with our short window, we need the strategic imagination to reimagine our future. And we actually have the science and the skill to actually do this, to be proactive about this space. Thank you.
Thank you so much, Kim, for painting such a vivid picture of what's happening on the ground. We will now shift gears from the regional and local perspectives to the global messages from climate and health experts. And no person more qualified to summarise this than Professor Catherine Bowen. Professor Catherine Bowen is a leading internationally recognised expert on the science and policy of sustainability, particularly climate change and global health. She has 20 years' experience in original public health research, science assessment, capacity development and policy advice. Catherine is regularly commissioned by international, bilateral and multilateral agencies to co-design solutions for sustainable futures. She was nominated by the Australian Government to be a lead author on the health chapter of the Intergovernmental Panel on Climate Change. Catherine also holds a joint position at Melbourne Climate Futures and is Professor of Environment, Climate and Global Health at the School of Population and Global Health at University of Melbourne. Catherine, so wonderful to have you here today. May I ask you to share some of the key messages from the latest IPCC report focused on climate change and health? And for our audience, many of whom are younger, what should we focus on to action?
Thank you, Georgia. Thank you for that lovely introduction. And I'd like to acknowledge that I'm coming to you all from the lands of the unceded Bunurong, the lands in Naarm in Melbourne. Unfortunately, there's a fair bit of noise going on around me. I'm in the middle of a car race for the next 4 days, so I hope that that does not affect what you can hear. I think that Dr. Ali and Dr. Liu, you really set the scene both at an international scale and also, you know, how we are faced with the health impacts of climate change at a local level here in Australia too. So as Georgia said, what I'll do now very, very briefly is to provide you with some of the key messages that have come out of Working Group 2's report. So Working Group 2 of the Intergovernmental Panel on Climate Change assesses the literature on vulnerabilities, impacts and adaptation. So I've got 3 key messages, but really the overall message coming out of the recent IPCC report is that the cumulative scientific evidence is unequivocal and climate change is a threat to human health and well-being and the health of the planet. So any further delay in concerted global action will miss a very brief and rapidly closing window to secure a livable future. So really for the first time in the IPCC report, what we've seen is a very tight interlinkage between the health of the planet and the health of people. So that was because the strength of the literature has really become much more apparent over the last 5 years, bringing those two concepts together. So the first key message out of this assessment is that the assessment has concluded that the health impacts of climate change, whether we consider what we've heard particularly from Kim just now around heat-related deaths and illnesses, all the way through to nutrition and food security and water security, these are all increasing. So since the last IPCC assessment on impacts in 2014, there is new evidence and awareness of the detrimental impacts of climate change on health and well-being. What we've seen in this report, and Kim alluded to this as well, is that there's been a particular increase in our understanding around mental health and mental health impacts. So that also distinguishes this 6th assessment report from the previous report. And also touching on issues of equity and justice, which Dr. Ali and Dr. Liu have already spoken about. And we know that these impacts of climate change on our health are unevenly distributed across and within societies, including Australia. And these will continue to be experienced inequitably as we assessed in the literature. Also, Kim, you mentioned this just now, we're really, for the first time, the assessment highlighted what we're seeing in terms of these cascading and compounding impacts. So again, if we look to the example of Australia, 2019 was the driest on record. This was then culminated in the Black Summer fires in Australia in the end of 2019 and the beginning of 2020, quickly overshadowed by the pandemic, as we know, followed by floods in some places in the beginning of 2020 and other extreme weather events. So these cascading and compounding impacts really affect individuals and societies and communities' ability to recover, as often there's very little time between the onset of these shocks. So this is particularly worrying, and we noted in the assessment that it's particularly worrying because we expect these impacts to increase with further global warming. So the second key message is a more positive one, going to your question really, Georgia, in terms of what is going well. We know that many risks for human health and wellbeing could in fact be reduced and some potentially avoided if we reduce our greenhouse gas emissions and strengthen our adaptation responses, particularly so that these adaptation responses specifically are proactive rather than reactive. And they're also effective. So there's a lot more research now going on in terms of understanding how effective our responses are. But I think that this goes back to your point too, Dr. Ali, in terms of we cannot wait till we have all the evidence. So we know already in most cases what we must do, particularly around mitigation. And so it really is about us forging ahead with the urgent and rapid transformations that we need to see so that we can reduce the health impacts of climate change. It is, there is though a very large gap, particularly in our, well, in both mitigation and adaptation, but this working group 2 was focused on adaptation. There's a very large gap in our adaptation efforts to date. So national planning on health and climate change is advancing across the world, but also subnational planning is advancing. So it was wonderful to see that the Victorian government released its health adaptation plan late last year and was finalised earlier this year. And now the challenge is implementing these plans. And this is really where we really must see more support from federal, state and local governments in terms of implementation. And it's also financial support. It's always a big issue, of course, but we know that the report assesses that financial support for health adaptation is only 0.5% of international multilateral climate finance projects. And this is absolutely insufficient to protect population health and health systems from climate risks. So again, it calls on us to consider the systems-based approach of understanding health and climate change. So we know that the majority of health impacts from climate change will actually emerge from other sectors outside of health. So agriculture, water, design, transport. So it's really, really fundamental that we do work beyond our own health silos, as is often the case. We often do work in a very compartmentalized fashion so that we can collaborate with other sectors where large differences can really be made. So then the third message really coming out of the assessment is that rapid transformations are needed to ensure that we do develop in a way that is climate resilient and sustainable. So we gave some examples in the health chapter about what this actually means. So for the health sector, this can mean universal access to primary healthcare, for example, and importantly, including mental health care in this. So in Australia, we have generally a very strong healthcare system, but in many places around the world, there are still major issues in terms of access to primary healthcare and universal health coverage. So it's really an area that is important to invest in and to strengthen so that we can ensure that we can support the health of our populations in the coming years and decades. Also related to what I said earlier is really around investing in other sectors such as agriculture and energy. And because it's really, really important to work in a collaborative way so that we're just co-designing responses, particularly when it comes to mitigation as well. And I think, Dr. Ali talked a little bit about the co-benefits we can start to see when we do reduce greenhouse gas emissions and the beneficial impacts we can see on our human health as well. And what we highlighted in the report was that the transformational changes that we need will be much more effective if they are responsive to regional, local, and of course, Indigenous knowledge. So they are really the three main messages that come out of the 6th assessment report, focusing on vulnerability, impacts, and adaptation. Thank you.
Thanks so much, Catherine, for sharing those important key messages with us. And as a young person myself, I'm particularly interested in futures that the impact of climate change has on my family, friends, and how our voice is represented. So I'm therefore delighted to be introducing Professor Susan Sawyer, the Jeff and Helen Hanbury Chair of Adolescent Health at the University of Melbourne and Director at the Centre of Adolescent Health at the Royal Children's Hospital, a WHO collaborating centre. Susan is a paediatrician whose efforts have helped to extend global understandings of the importance of adolescents and their health and well-being in Australia, in our region and globally. She has held numerous advisory roles for the WHO and is the inaugural co-chair of an Australian network of WHO collaborating centres. Welcome, Susan. Could you please share with us the impact on health of children and adolescents of climate change, and also how best can their futures be represented in a world where power is predominantly held by the older generation?
Thanks, Georgia. And the Australian network of WHO collaborating centres is just delighted to be co-hosting this really important event to celebrate World Health Day, although it feels like we almost commiserations need to be given in terms of what we're seeing across our screens in Ukraine at the moment. Like others, I'd also like to acknowledge the Indigenous owners of the land. I'm speaking to you from Wurundjeri land in Melbourne. And I'm really increasingly concerned about the impact of climate change on the health of children and young people. What we know is that the very young and the very old are most at risk in terms of death from extreme heat and from water and food insecurity that we know are equally part of the challenges resulting from climate change. But as others have already mentioned, in terms of recent floods in Northern Australia or the fires from 2 years ago, we can all too readily appreciate the immediate disruption to children's and young people's lives. So in Australia, I gather that the studies I've seen are sort of, all the numbers I've seen have suggested that there's been about over 5,000 homes lost in the recent floods. And in the fires from 2 years ago, over 3,000 homes were lost there, with many more thousands and thousands of lives being immediate displaced, which risks catapulting families into poverty, completely risks then interrupting children's and adolescents' educational and employment trajectories. And in the immediate aftermath, children and young people are much more at risk of accidents and injuries, of interpersonal violence, and a wide variety of traumas that really affect young people's lives, most notably traumas in relation to mental health. And I think of the types of these environmental disasters and extreme weather events as a little bit like a pandemic that we've just seen, but a pandemic on steroids. And as we've sort of seen in the shadow pandemic of this sort of long tail of mental health issues that have been experienced beyond the immediacy of the pandemic, it's very apparent that the slow pace that many families require to rebuild lives and to regenerate the sort of resources that previously they provided for these families can equally create an incredibly long tail with long-standing impacts on the health and well-being of children and young people, with the risk that this reverberates then across their future lives. But the climate crisis affects children's and adolescents' lives, even for those not directly affected in environmental disasters. And last year, there was a really powerful study that was published in Lancet Planetary Health by Hickman and colleagues that surveyed around 10,000 young people aged 16 to 25 in 10 different countries, about half of those countries being high-income countries, including Australia, and the other half being low-income countries, including Brazil, India, Nigeria, and the Philippines. And basically what that study showed was that 3/4 of young people were at least moderately worried about climate change across the world, but that nearly 2/3 of them were either very worried or extremely worried, the highest category. Over 50% reported feeling sad, anxious, angry, powerless, helpless, guilty, 50% for each of those emotional responses. And interestingly, or concerningly perhaps, nearly half of respondents said that their feelings about climate change negatively affected their daily life and function. This is not brief thoughts. Respondents also rated governmental responses to climate change very negatively, and they reported greater feelings of betrayal in response to government actions than reassurance. And that it was very interesting, I felt, that climate anxiety and distress were correlated with individuals' perceptions of the inadequacy of government responses and the associated feelings of betrayal they had. These issues of the climate crisis concern children and young people greatly. Now, we need to then think about, well, what does that mean in terms of thinking about intergenerational equity and what it really looks like in practice? As a paediatrician focused on adolescent health and wellbeing, I think of intergenerational equity really in two different ways. One is from the perspective of the life course, if you like, which I think helps us to really think about the broader consideration of people's lives and the health and outcomes of people's lives within structural, social, cultural contexts, whilst we focus on life stages. And so we can think about infancy or under 5-year-old children, we can think about school-age children, adolescents, young adults, older adults, and the elderly. And whilst, for example, within the Millennium Development Goals, there's a really strong focus on under 5-year-olds and reducing under 5-year-old mortality, at least within the SDGs, within the MDGs, and I would also argue within the SDGs, there's been absolute neglect of the health of young people. And I think in our region, it's really well worth reminding ourselves of population pyramids, changing demography, and median age, the age at which 50% of the population is less than the median age and 50% is older. Because in Australia, our median age is 37. In Fiji, it's 28. But in Papua New Guinea, the median age of the population is 22. That means half of the population is aged under 22. So in terms of a life course approach to thinking about equity, you know, as I see it, it means that considerations of equity really need to relate to what developmental stage we're investing in, and really needing to think about, if you like, a balanced portfolio of investments across the life stage, but also thinking about the nature of those investments, recognising that the earlier in the life course and children and adolescents, those investments really need to be focused very strongly on prevention in order to prevent then the necessary expenditure of the limited health dollar later on in life. And obviously tobacco control and the investments in primary prevention are a prime case in point here. But I think a little bit like Dr. Ali said, you know, I think we equally are needing to think about how we pivot more quickly to invest in emerging health issues. And I think here of children and young people have been canaries in the mine. And in relationship to mental health across the life course, we know that it is young people who have the highest rates of mental disorder, and this is the time of onset of new mental disorder. But we absolutely are needing governments and policy investments pivoting more quickly to these emerging issues, mental health being a prime one in relationship to the climate crisis. But if we think more broadly in terms of food insecurity, growing rates of obesity and type 2 diabetes, then the preventive interventions need to be targeted on children and young people. So in that sense, from a life course perspective, intergenerational equity really relates to the life stage we're investing in, the health problems that we choose to invest, and the nature of those interventions. But the second way of thinking about intergenerational equity is really around how we meet the needs of the present without compromising the ability of future generations to meet their needs. And this is really about the concept of fairness amongst the generations and the use and the conservation of our environment and our natural resources. And I think this is where, again, adolescence can be incredibly central to this, as we've been seeing, for example, with the advocacy of amazing people like Greta Thunberg. And this is where I think that when we think of adolescence, rather than thinking about adolescence as the end of childhood, as so many people have historically done, recognising that adolescence is actually the start of the next generation. Adolescents and young adults are the next generation to parent, and therefore getting a healthy start to life for the next generation really needs to start with investment in adolescence. And this is where I think that, you know, we really need, in terms of thinking about investments in adolescence, this is requiring us as adults, as those who, as you were saying, Georgina, the power holders in communities. You know, it's about us. How do we hand and share power, hand over power, share power with the younger populations? This requires us to listen to young people, not just to listen for the sake of it, but then to act on the sorts of activities and interests that young people are requiring, the demands that they have. And I think this is where, you know, we can absolutely be celebrating the environmental activists, you know, and Anjali Sharma, for example, you know, who at the age of 16 was among 8 young people who took the federal government and Susan Ley as the environmental minister to the High Court of Australia for their failure to consider the impacts of climate change for the next generation. But in a sense, rather than having to rely on those one-off investments, I really feel that one of the ways that we can much more better listen to young people as a community is if we were to lower the voting age. And it's really interesting that 100 years ago, the voting age was 21 in most countries. At the end of last century, in most countries, it was 18. But over the last 25 years, there's been a real shift in many, many countries. You know, it's about 30 to 40 countries to lower the voting age from 18 to 17 in some countries, but in more countries down to 16. This is the case in Scotland. This has been the case in Wales. And for example, in the ACT at the moment, the Greens have got a bill to lower the voting age to 16. Similarly, the Greens in New South Wales, the Labor government, Bill Shorten in the last election had promised to reduce the voting age to 16 as well. So I think at a really practical level, one of the ways that we can really listen to young people and place them centrally in the climate change agenda, which is so important for so many young people around the world, would be to also include and extend voting suffrage to young people as well, and to have them be part of the political solution and force politicians to be really listening and investing to young people rather than just paying lip service. Thanks.
Thank you so much, Susan, for all those inspiring messages, and particularly for your live work on this theme. So it is a really good segue to talking about processes and platforms and positive solutions to work together for change. And another platform that is increasingly active in its relevance in communicating the impact of action on planetary health is that of medical journals. And I'm simply delighted to welcome Distinguished Laureate Professor Nicholas Talley today. Professor Talley is an expert clinician, educator, researcher with extensive experience as a leader in the medical and university sector. He's been Pro Vice Chancellor and Dean of the Faculty of Health and Medicine at University of Newcastle, and also served there as Deputy Vice Chancellor Research Acting and Pro Vice Chancellor Global Research. He's a neurogastroenterologist and has published over 1,000 papers in peer-reviewed literature, and is considered one of the world's most influential clinical researchers. Since 2015, he's been the editor-in-chief of the Medical Journal of Australia. And I'm pretty sure there's not a single medical graduate in this country who was not schooled, including myself, on the basis of the yellow, I think it's still yellow, Talley and O'Connor book for clinical examination. In June 2014, Professor Talley was inaugurated as one of the first 15 fellows of the Australian Academy of Health and Medical Sciences. and was elected to executive of the Academy. And I'd like to pay respect to this Academy here today, because as we speak, another event led by them is on, and it is chaired by a number of our own elders in climate change and health, where they will launch the Academy Statement on Climate Change and Health today. So Nick, it's taken the medical community a rather long time to understand and actively promote planetary health and climate change and health in their own curricula, but also in journal pages. Your journal, the MJA, has been one of those here leading action in this field. And as a fellow medical editor, I'd like to ask you to share with us not only the global position of medical journals on this theme this year, but also if you could speak on how the health community could best use these and their own platforms to act. Over to you, Nick.
So thank you, Selena, and thank you for the invitation to spend some time talking today about this topic, which I think is one of the most important health issues, of course, that we face. And you've heard a very compelling set of arguments and comments from the panel already. I'm going to come at this a little bit from the position of being a medical practitioner and talk about what I would call our duty of care as a health professional. But it's, of course, not just confined to medical practitioners or other health professionals. This really applies to other leaders and, in fact, the whole community as we galvanise, I hope, to make a difference about our climate so that we can ensure our health continues to remain great and indeed improves rather than deteriorates, which is the big risk as we face going forward. I'm coming from a Wabakal land and I pay my respects to elders past and present as well, and Indigenous people here today. Next slide, please. I've only got a few slides, but I thought I'd show these just to illustrate some points that I think are important. First of all, it's incredibly unfortunate that climate change has become or has been politicised. And one of the key messages, I think, is we need to demand as a community the depoliticisation of these issues. This isn't a political issue. This is a health emergency issue. And we really have forgotten this in the public debates until very recently, although I think it's fair to say that government views are changing on all sides of politics. And I think people are starting to recognise with the recent floods, the previous droughts and fires, the Japanese encephalitis outbreak in states that's never had this. People, many sensible people, are starting to recognise this is serious. We're living it now and it's going to get so much worse. And we've got to remove this from the politics and insist whoever is in power, we are driving change that matters. And I think that's the critical message for all of us as we think about what we're going to do. I mean, population health has always been a political football in many ways, but in this case, it's just too important to remain. It's a bit like the COVID-19 outbreak that, really wasn't a political issue, thankfully. It wasn't dealt in that way, although you could argue about some of the response that we had. We know we're at very high risk of more events, more droughts, fires, floods, pestilence, famine. There's already migration and there'll be more. And of course, there's the threat too that this will lead to major conflicts. It's really serious. It's not just about the direct effects, it's the indirect effects of climate change on health that we're all going to face. And the reality is we're not going to make 1.5 degree increase either. At least according to the World Health Organization and to the United Nations recently, we are going to go above that number. How high? We don't know, but we're not doing enough to bring it down or to make sure we reach 1.5. And so I think this is absolutely critical to remember. We are at a very, very, very critical time. Next slide, please. So medical journals have been active. The Medical Journal of Australia has partnered with The Lancet and worked very hard on providing annual reports or the authors have worked very hard, the journals publish this, worked very hard to provide annual report cards on Australia's progress with improving our climate change in this country. And we get a failing grade from those reports, which is remaining concerning. And in fact, we published an editorial in more than 200 journals globally. This was the medical community, including some of the leading journals in the field, about this emergency with climate change, emphasising that at least from our point of view, the medical community wants to see very significant change going forward. We have failed so far. We must do more. And of course, calling for change doesn't mean there will be change, but at least it emphasises there is very much consensus amongst the medical profession, I hope, that climate change and health are interlinked and are really important. But I want to point out, I run into my colleague physicians here and there who have been completely opposed to the idea of the medical profession getting involved here. They have argued it's outside of our expertise and we just shouldn't deal with this. It's just not an issue that is relevant to the profession. Next slide, please. And I just want to refute that. I think that is completely inappropriate. We have a public health emergency, just like with COVID-19. It was a public, or still is, a public health emergency. You don't just throw your hands up and say, we're not going to do anything or worry about it because it's outside of what we usually do. We've got to take action as health professionals to help lead the change and drive the change that's required. And there are 5 pillars on this slide that sort of summarise some of the thoughts that have been suggested in the literature about what health professionals can and should do. And of course, this doesn't apply just to them. Educating ourselves is one of those issues. Growing research, because there needs to be more work on the actual direct links between climate change and health, although we all know it's highly relevant. We need to be driving healthcare resilience in our communities and insisting our health leaders make this happen. And that requires us to drive it and make noise about it and actually do something. And decarbonising our institutions is possible. The NHS in the UK has taken a big lead here about decarbonisation and have shown the way, and we can follow if we're sensible. And I think that's absolutely critical. But in the end, it's obviously terribly important that we ensure that we take responsibility and drive and lead rather than just sit back, like some of my colleagues have still been suggesting. Next slide, please. And so I think we can do more, we must do more, and there are models that allow us to, in fact, make that happen. I would also suggest for those who know less about the actual science, they get themselves educated. I believe the only way you can influence others is to make sure you know the facts and actually understand the science, and then you can educate others who are relevant, leaders in the community, our colleagues, and of course, if we're health professionals, our patients. And that really is one part of this. But we can do more than that. We can get involved. We can drive organisational change. We can insist that this happens. And we need to do it, and we need to do it now. So as a medical journal editor, I hope we've made some small difference, but that's not enough. As a medical leader, I hope we've made some small differences. That's not enough. We've got to do so much more to ensure that our children and our grandchildren inherit a world that is not only livable, but a glorious place to be, rather than some awful alternative. Thank you very much.
Thank you so much, Nick, for your contribution. That was really fantastic. I would now like to welcome back Professor Anne Poelina to end our panel session. Anne, we know that you were recently part of a global effort to integrate Indigenous knowledges in the current discourse of planetary health, and you jointly with other First Nations authors globally published in the Lancet Planetary Health a really wonderful paper on this that I so appreciate. So within global platforms, the role and involvement of First Nations communities in planetary health is being increasingly communicated. What message do you have for us on World Health Day to help us integrate all the challenges that have been presented even on this panel, and help us understand the critical importance of the role that Indigenous communities play in this theme here in our country, but also globally? Over to you, Anne.
Yeah, look, thank you very much. I think one of the things that the globe is that we are testosterone out on science. We need new ways to tell the story to bring the people with us. What we are seeing is that we've shifted from climate change to climate chaos and climate wars. And we need a new way to look at how we decouple the complexity of these systems that are causing these consequences. So in my land and in my culture and with the conversations that I'm having globally, what Indigenous people are saying is that it's not just about sustainable development. It is also about sustainability of our lifeways as Indigenous people, as planetary citizens, and importantly, our young people. In my culture, we have a word called bugaragara. Bugaragara means how do we learn from the past to situate the future in the present? How can we ensure that our young people across the globe will have a future? And the challenge is before all of us at this moment in time to look at how we bring all of this collective wisdom in to framing how do we deal with this complexity. A lot of the things that my fellow panelists have been talking about are out there as symptoms. What I see as the root cause of the failure of where we're going as a nation and as a globe is that we are failing at so many different levels. We are failing particularly in terms of my earlier conversation of how do we create peace with Indigenous people and with nature. Many years ago, I stood in the IPC podium with the then Minister for the Environment, Nicola Hulot, and he said, Indigenous people around the world are holding the last bastions of biodiversity. They make up such a small percentage of the world's population, yet we hold planetary solutions for where the crisis is going right now. It is time to stop othering the voices of Indigenous wisdom. It is time to bring us in to look at how do we sit around the table and start to look at how do we create peace with nature. We are decoupling the energy systems by continuous extraction. We need to find new ways to create these new economies. But importantly, when we look across the world, we see an increase in green crime, state-sanctioned violence, which is lawful but awful. It is creating the destruction to the planetary systems that hold the life force of our world and with nature. So what we're saying as Indigenous people is that we need to bring Indigenous wisdom into the IPC modelling. We need to bring Indigenous wisdom into local government, because everything is place-based. Everything that we know are the laws from the land, not the laws from man. So we need to find ways to be brave, because what we require is a level of braveness that is beyond human capacity right now. We need to come together. We need to feel Mother Earth. We need to hear Mother Earth. We need to hear the wisdom of Indigenous people and say, how do we do this with a spirit of goodwill? Because what we're seeing is that Indigenous people do hold some of the solutions of being able to address planetary health. In terms of solutions, what would we look at? What would we consider? And as Indigenous people on those last bastions of biodiversity, where the rivers are crying out to humans to say, what are you doing? The rivers are the rivers of life. And what we're saying is that these living systems, this multi-species, also requires justice in order for us to live in peace and harmony. We need to dream new dreams. We have the potential. We are the greatest species on the world because we are human beings. We can think, we can reason, we can have logic, we can challenge, we can bring in new information to look at how do we do these things. But what we're saying is that it's time to realize that as Indigenous people, we care, particularly in our nation, Australia, who failed so badly and copped out at the last COP conversation. We need to find new ways to consider how do we advocate for a just energy transition. We need to support and upskill workers who are working, created a sense of allow them to go to the bottom of the heap. We need to seriously invest in them. We need to acknowledge the opportunity to build peace and collaborate with us who are at the front line of these invasive, unjust developments. We need to, in my language, wake up the snake, wake up the consciousness of the people to bring the people with us, because nation states are failing, and they're failing very badly, including my own country, Australia. So we need a new way to dream, to reimagine what planetary solutions and the health of Mother Earth can be. We need to find new ways to lift the voices of young people. And last night when I was watching the news on the drum, I heard the horrific stories of the morbidity and the mortality rate of those volunteers who went and fought in the front line of the fires. These people are dying. They are dying because they were brave and they reached out to help their fellow Australians. Yet are we going to turn our back on them? Of a portion of hope was a young man in year 9, 14 years of age, who has created a news channel called Channel 6 News, where he is telling truth. And so what I'm saying is that young people's voices are rising. We saw the case that was spoken about against the Minister for the Environment, which young people led, but they lost because our Minister for the Environment did not believe she had a duty of care to young people, not just living now, but to be born in the future. So what we're saying is that it takes all of us to work together, that we must find a unity pathway to sit around the table as good and decent human beings. These challenges are only going to get worse. We need to find the way to create a political goodwill of looking at how do we decouple failing governance and failing government, because this is the critical core of the culture of violence that is occurring not just to young people, not just to nature, not just to Indigenous people, but the way government is doing business to allow the patriarchal movements that continue to decouple the failing systems through constant extraction. So what I'm saying is that Indigenous people are standing. We are coming in Australia with a gift of peace, a treaty of peace to our fellow Australians, because our story is, this is your story. Your DNA is embedded in this landscape. It is embedded across the planet. And it is time for us to all wake up and unite and to value this wisdom and to see traditional knowledge as Indigenous science that can sit alongside of Western science and work together in a spirit of cooperation and goodwill to look at how do we imagine and reimagine the world that we want to leave our young people as their due inheritance, a planet that can stand and be resilient. Otherwise, we are headed for doom. And as I said, and I say to the Rebellion Extinction people, yes, Mother Earth is powerful. She can right-size herself, but she will be lonely without the vibrations of human beings. The challenge is for each and every one of us to feel the planet, to hear the planet's cry, and to say, yes, we will stand in earth justice with Indigenous people, with our fellow scientists, with those practitioners and those activists at the front line to say that it is no longer business as usual, that we must challenge ourselves and say that if we are going to leave our young people globally a world that we think they are due to inherit, then the work must happen now. So Galia Mabu, thank you for listening. And I think it is all about stories. We need to find a new way to tell that story, to wake up the consciousness of the people and to bring the people with us to heal the planet. Galia Mabu, thank you.
Thank you so much, Anne, for the generosity of your wisdom. I know that all of us, I'm sure, share this sentiment. You can see all the love given to you on the Zoom screen. Please don't go hidden, because I'm actually going to call all of you back to the screen to show your faces, and also Georgia. Thank you. We're now going to open for Q&A, and this will just go on for a few minutes before we end our session. I would like to hand to my co-host, Georgia, for the first one.
Thanks, Selena. We've got a question from Grant, and I'd love, Susan, for you to answer this one. And it's actually addressed to you. Susan, how can we give young people a sense of agency and empowerment on environmental/climate issues?
As I was alluding to, Grant, I really think it's about finding some structural ways in which we genuinely start to listen to young people around, you know, the notion of co-design in research is one that you will know very well, but it's really co-designing our future, really doing what Anne was so beautifully articulating. How do we find, how do we build young people into the day-to-day decision-making and power structures? One of the examples I gave was was around lowering the voting age. And I actually feel incredibly impassioned about the importance of this. A bit like Nick, I felt reassured, Nick, with you sort of saying the challenge of being taken out of one's comfort zone, because in terms of a professor of adolescent health calling for lowering of the voting age, you know, the stretch between empowerment of young people and health, I think for many people might be a fairly big stretch. For me, it just seems immediately obvious that we have to, as communities, as families, as local organisations, as school communities, listen much better to young people. And we need to learn to share power. It's actually about engaging with young people, not in tokenistic ways, but actually in terms of sharing power.
Thanks very much, Susan. I have a question here from Scott, and I was hoping that perhaps Catherine or even Kim could tackle this one. Just to let the audience know that Dr. Ali had to go because he has many duties on World Health Day, but we will share our gratitude to him later for joining us today from Fiji. So Scott asks, health services are a microcosm of the wider world in the sense that exact policymakers are not doing enough fast enough. Is it time for a bottom-up approach to empower the workforce itself to take ownership of sustainability programs in health services to facilitate practice change faster? And it's also linked to another one in the live chat. I'm just going to find it. There was another one. Essentially a localised one that from Rob, which is, we have a great opportunity here in Victoria to have this planetary health concerns embedded as a clean plank for local public health units as they refocus on population health and prevention. But how do we ensure this? I'm wondering, Catherine, if you could tackle this, or if anybody else wants to jump in.
I'm happy to, Selena. I'd also just like to thank Anne for her incredibly powerful words, and I'm really still processing a lot of that. So thank you so much, Anne, for all those words. So I think this is happening already. We're seeing this in many examples so I'm most familiar with the Victorian health system in Australia. Overseas, I'm more familiar with systems overseas, but we're seeing a lot of healthcare facilities and hospitals really starting to embark on their own activities around sustainability. So many of them are aware, and I'm sure people on the call are aware of the WHO's guidance for climate resilient and environmentally sustainable healthcare facilities. And this set of guidance is actually quite helpful. And so many organisations in the health system are starting to look to these guidelines and really see how they might be adapted to their own setting. So I absolutely agree. We can't expect our policymakers and our amazing public servants to be doing all the hard work in the centralised locations that they work. It must be a joint approach, and really also linking in, sort of developing communities of practice in a way amongst different healthcare facilities across your own region, across your state and across the country, to share and exchange experiences and what's working, what could be done differently. So I think there's a lot of scope to really build up those communities of practice too, Selena.
Thanks very much, Catherine. Great. Anne, I think this one is for you, but just to let you know, if you haven't seen in the question and answer, there's a lot of love and also gratitude for your speech just then. So this question is from Marina. Anne, thank you so much for your wisdom. You enliven the heart elements of this existential climate crisis so powerfully. But how can non-Indigenous young people engage most effectively to amplify and learn from Indigenous wisdom to support a future that is decolonised, harmonious and sustainable?
Yeah, the first thing I would be saying is, from watching last night, everybody needs to tune into Channel 6 News. These are young revolutionaries who are critical thinkers, who are pushing the boundaries of truth-telling. They are putting their voice out there. They are giving voice to these solutions. So I would be saying, first of all, get to know them and get to hear their wisdom, because young people are wise. In terms of the things that we are looking at, I think it's very, very important that we start to feel the country on which we live. A lot of people that I speak to that live in the cities, in Melbourne, in Sydney, and Adelaide, they go, oh, how do we connect with Indigenous people? And our message is, as we said in the Treaty of Peace, is that we want our fellow Australians to feel their country. This is your land now. Your DNA is embedded in this cultural landscape. We want you to learn how to feel your country, whether you're in the eastern suburbs of Sydney or whether you're sitting on the banks of the Yarra. The systems are alive. The land and the rivers hold memory. And when you connect, it will create a relationship. You must be brave and do that, and go and sit quietly amongst nature, because what we're seeing is the total destruction of the planet. And we want fellow Australians, and indeed the rest of our planetary citizens, to do this, to feel the land, to hear the cries of Mother Earth, to hear the sounds from the rivers that are asking the questions of what are the humans doing. So it's really important. What we're saying, and a lot of the work that I do is around how do we bring first law to complement the law of Crown law? How do we get that fusion? Because what we're asking you to do is to shift from a world of me to a world of we. And so collectively we can come together. We must come together. We must bring all of this in and start to look at place-based solutions. I totally believe in local government. I know from my experience in local government that this is a channel in which we can build a unity pathway, a way to have better cooperation, to share information so we have informed consent. So I'm really advocating better regionalism. I'm encouraging everyone who's on the panel today and who's listening to go and feel the land, go and hear the land, listen to the land, and create within you an ethics of care and attention for what we are doing. We need a total debunking of all of the way that we're doing business to move to what we are calling an ecological governance model framed in science with all of the evidence, including Indigenous science, to look at new ways to do business, because we can create the forever industries that I talk about, the geoparks, the biosphere reserves, the bioprospecting. We have plants on our country that are beneficial to humankind. How do we get those sorts of things right? So it's about creating relationships. It's creating a dialogue. It's asking you to be brave, to reach out to those Indigenous people who live around you, who want to share with you, who have a rightful place to be co-designing and dreaming the new world with all of us collectively.
Thank you so much, Anne. So we will need to start concluding our time together. I'm not going to let the panel go just yet, but I would like to ask each one of the panelists to assist Jessamy and ourselves in understanding your key message. If you were to have the world leadership listening to your words, what would be your very short message for them? And there are 5 of you, I think, now. So we'll start with, in the order we started, which was Kim. 1 sentence, 2 sentences is probably all we can time-wise manage.
So again, I say that we need to work local because we still need to be able to help people around us reimagine what we can be in terms of decarbonised society. But working locally and building your community is the most important thing, because all of us are going to be impacted by climate change. But the thing that's super important is to build community and be in a community.
Yeah, fantastic. Thank you, Kim. Catherine.
So from my discussions with policymakers, what they want to hear are stories, so narratives. So I would ask them to ask their children or their grandchildren, or if their nephews or nieces, to tell them what planet they'd like to live in. And that, I think, really connects with our emotions and really could go somewhere to creating a better place for us all to share.
Thank you. Susan.
Thanks, Selena. Young people are our future, and when we invest in their capabilities, we can generate the transformative or allow the transformative power that they have to really then create influence within the planet and the countries and the communities in which they are potentially influential. And I think that requires us to also invest in changing political structures and frameworks that truly enable young people's voices to be better heard than what they are at the moment when they're shut out of the decision-making practices.
Thank you, Susan. Nick.
In a few words, we need to insist our political leaders and other leaders take action, lead by example, and show us the way. And if they don't, we need to throw them out as quickly as possible. We're having an election this year in Australia. Well, we need to insist, whoever we vote for, they take action, they lead by example, they mean what they say, and they do take, and we hold them to account once they're elected, or we throw them out as quickly as we can.
Thanks, Nick. Anne?
Yeah, no, it's so true. You know, young people are the future, but young people are living now. They are demanding this change. They are echoing their voices across the planet. I totally agree. I think we need in Australia to have a party of young people, to have their own political party, because they have new dreams and they have new ways of decoupling the system, and they are amazing communicators who can tell the story and bring us old folk with them. So from that perspective, I totally agree. Everything is place-based. Get to know your country, get to feel where you are, get to hear the landscape. And what we're saying is that I have a real hope, and I call it, you know, we reach down into Pandora's box and we pull it out. And I think this conversation is showing me and giving me confidence that we
I think Anne has cut out. Are you there, Anne? Yeah, coming back. I think we might have some problems with your bandwidth.
and build a coalition of hope to give Mother Earth a climate change.
Thank you very much, Anne. And finally, I'm going to put Georgia on the spot because all the messages lead to you, Georgia. Firstly, thank you so much for agreeing to co-host with me today, but what would your final message be?
Along the lines of Susan and Anne, I think I'd like to see that the knowledge, the lived experience, the advocacy efforts of young people, and specifically Indigenous youth, should no longer just be seen as a symbol of hope, but instead should be considered in the co-design of policy and interventions and respected as valuable contributors in generating long-term sustainable climate solutions, as well as being an opportunity to support the youth mental health issues that we see are on the rise.
Thank you so much. So to all our panelists, thank you so much for the generosity of your time and wisdom. And we are so grateful on World Health Day. To our partners, CAHA, WHO Collaborating Centre, MSDI, Melbourne University, thank you. And to our audience, thank you for giving your time and trust. To the people behind the scenes, Abby and Piali and Jessamine, thank you for your artistry as usual. I wish you safe passage and a good World Health Day, and I hope we meet again very soon in this forum or another. Thank you.